Artificial intelligence technologies are emerging to help physicians, nurse practitioners, and physician assistants write notes in real time using dictation software. This is extremely important as EMR, electronic health record note writing, is a major contributor to physician burnout. After obtaining consent from the patient, either electronically in the EMR or in a paper form, or after the patient gives verbal consent in the clinic room, the provider can turn on the digital scribe application, sometimes on their smartphone, that will listen to the clinic visit and write a HIPAA-secure, cloud-based note. Here's the super cool part. Artificial intelligence knows how to separate out information provided by the patient to go into the HPI or history of present illness. AI technology will listen for medications, social history, physical exam and assessment and plan, and places information in the correct place and format. At the end of each patient visit, physicians can still edit the note, but the AI software dramatically reduces the amount of time spent typing so that physicians can focus on the patient conversation and talk in a much more natural way. Physicians will no longer have to ask patients to slow down their descriptions. Now, how does this all work? Intelligent documentation support software uses speech recognition, natural language processing, and artificial intelligence to write notes and to help automate tedious clinical documentation, which physicians and medical providers spend hours each day typing out. This AI software, produced by several different companies, now allows physicians to focus their attention on data gathering, asking important questions, and trying to develop an assessment and plan instead of being bogged down by typing. Administrative tasks like typing in the EMR and paperwork are one of the biggest causes of physician burnout. One study published in the Annals of Internal Medicine found that physicians allocate approximately 49% of their time on administrative tasks, including EMR and desk work. So intelligent documentation has the potential to make clinics more efficient and allows physicians the ability to see more patients each day. In a very interesting 2021 study involving 307 primary care physicians who practice medicine across 31 primary care offices at Massachusetts General Hospital and Brigham and Women's Hospital systems in Boston, physicians use the EHR for 36.2 minutes for a 30-minute clinic appointment slot. The patient visits average 6.2 minutes of nighttime work from home and 7.8 minutes of EHR inbox work to follow up on labs, pathology, and patient questions. Medscape's 2022 Physician Burnout and Depression Report found that 60% of physicians reported that, quote, bureaucratic tasks, e.g. charting and paperwork, end quote, contributed to feelings of burnout. Artificial intelligence technology to assist with EMR documentation has the potential to decrease physician burnout and to provide highly accurate notes that include patient descriptions of their HPI or a history of present illness. The AI software remembers dates and numbers easily. This is super helpful in a gastroenterology clinic when patients are describing, for example, how many bowel movements per day they've been experiencing if they have constipation or diarrhea, or specific dates they experience rectal bleeding. Another example might be a particular date for an ER visit that the patient said very quickly in passing. When using the dictation software, I try to summarize the findings of important CT scans, MRIs, and ultrasounds. Before each impression, I'll mention the date of the imaging, and the AI software will organize all this information into the note. After the AI technology develops a well-organized note, you can still edit by typing any aspect of the note you like before signing. Software such as Abridge, DeepScribe, Atlas, Ambience Healthcare, Nabla, Suki Assistant, Nuance DAX, Copilot, Oracle Health Clinical Digital Associate, and Freed have the potential to improve the delivery of healthcare by allowing physicians and medical providers such as nurse practitioners and physician assistants to focus on patient conversations. There are many AI dictation systems that have recently launched, so hopefully this will help keep driving the technology forward. Whenever possible, I recommend that physicians request a pilot trial of the software before expanding system-wide. There are many pros for AI-enhanced dictation software, including helping providers finish their notes during clinic hours and reducing the time spent outside of work completing notes. For providers who haven't taken a keyboarding class or mastered hand placement on the keyboard, AI dictation can significantly improve the ease of writing notes. By typing less, physician and public health leaders hope that AI clinical documentation technology will prevent musculoskeletal repetitive stress injuries such as carpal tunnel syndrome and de Quervain's tendinosis, which is an inflammatory condition causing pain and swelling in the tendons between the wrist and thumb. Our hands will feel less tired at the end of the day. Some patients have told me that they like AI documentation because it illustrates that a healthcare organization or private practice group is invested in modern technology that improves clinical care. AI also can speed up the process of helping physicians write after-visit summaries, which are important for keeping patients organized. However, there are some potential negatives or reasons that some physicians might hesitate to adopt AI dictation technology. For some gastroenterology subspecialists like IBD or inflammatory bowel disease physicians, the AI software might not include every single detail for the patient's extensive colonoscopy medication history in exactly the same way that IBD specialists would like in their documentation. Sometimes the AI can make histories a bit too generic. However, over time, I fully expect that AI-assisted electronic dictation software companies will fine-tune this technology to include the extended content frequently written by subspecialists. It's very important for physicians to work with their IT departments and the software company prior to launch of this electronic documentation software to fine-tune specific preferences. Another potential negative for using this software is the time that it takes to dictate long paragraphs from CT reports or pathology reports. In these circumstances, I recommend that physicians consider copying and pasting the most important findings from these reports into the notes separately. This can easily be done by using AI dictation for the rest of your note. From my experiences, the AI software works well for common GI problems such as constipation, heartburn, abdominal pain, diarrhea, etc. Sometimes the AI software might not include a small section of your dictated plan, so it's important to read through the entire dictation and make any necessary edits. During my notes, I try to give the AI lots of directions by saying, include this in the plan, which definitely seems to help. A 2021 study by Wang et al. Showed that, quote, the digital scribe was about 2.7 times faster than both typing and dictation. For physical exam sections, the digital scribe was about 2.17 times faster than typing and about 3.12 times faster than dictation. A major goal for digital scribe software is to allow healthcare providers the ability to dictate in a manner less expensive than traditional transcription services to save money. In addition, digital scribe software is much more efficient, transcribing the note in 10 to 20 seconds instead of waiting hours. Literally, you click Create Note, wait a couple seconds, and it's done. In medicine, though, we have to be cautious about choosing the right kind of AI-driven digital scribe application we choose for clinical documentation. Not all AI is created equally. The software should be created specifically for medical use. For instance, a recent study by Baker et al. In the Journal of the American Academy of Orthopedic Surgeons showed that ChatGPT could potentially, quote, improve clinical documentation by producing more comprehensive and organized HPIs, end quote. However, the double-blinded study showed that, quote, ChatGPT included erroneous information in 36% of the documents, end quote. So it's definitely a good idea to stick with validated software programs specifically designed for medical care. In its current form, ChatGPT would not be an ideal choice. It's a good idea for healthcare organizations to select AI software that will delete audio recording at the end of the patient visit. From personal experience, I would say this is the most frequent concern among patients who have started using this AI-driven software during clinic visits. It's very important to explain the artificial intelligence dictation security at clinic check-in and again during the beginning of each patient visit. It's also a good idea to include a sentence in the clinic note referencing that you have permission from the patient to use the digital scribe software. Amazingly, some future artificial intelligence applications in development include the ability to automatically generate billing codes from intelligent dictation documentation software. This billing technology is starting to emerge using a mixture of machine learning and natural language processing. Over time, I expect AI to help physicians and medical providers bill more efficiently with less clicking using their real-time dictations in the clinic and for endoscopy procedures too, and surgeons can use it for operations as well. AI-powered clinical documentation software has the potential to revolutionize the way physicians, nurses, and physician assistants take care of our patients. From personal experience, this AI software allows physicians the opportunity to focus on patient care without the physical and mental energy drain of typing notes all day long. The technology has the potential to help clinicians build rapport with patients more easily, allowing us to look patients in the eye, to have more natural, free-flowing conversations, and allows us to express empathy more easily, instead of having our heads buried in the computer, typing away during a clinic visit.